from Louisiana's home team. This is Fox 8 Morning Edition at 6 a.m.
It is now 7:29. Women, and especially mothers, often neglect their own health because they're busy taking care of others. And Dr. Meredith Maxwell with the Touro Infirmary joins us this morning with steps so women can follow these to stay healthy at all ages. Good morning.
Good morning.
And it's so true because women are juggling so much, taking care of the man in their life, the kids, their co-workers, their bosses, and all the things that they have to tend to make sure they stay on the job and stay on the job at home. I guess you can see that when you treat women.
Definitely, definitely. That's why it's so important to establish care with a primary care physician, get your preventative annual exam. There's so many things that you can do to be healthier, to prevent things from coming down the road. So it's extremely important. It needs to be tailored individually to each person.
Before we get into the specifics, let's talk about some of the things that you see many women suffering from because they ignore their health.
Uncontrolled blood pressure, pre-diabetes that could maybe be controlled from going to full-blown diabetes, a cancer that could be easily treated before it becomes something big. There's lots of things that you can kind of prevent from progressing, and that's kind of what we do. The best right now in medicine is preventative care, prevent you from getting ill.
Well, let's talk preventative. Let's start with some of the basics. What would you advise if a woman came to your office and said, what are some of the things I can do? Give me a list of those things.
Well, definitely a yearly blood pressure check, because you really don't check those. A screening for diabetes, screening for cholesterol depending on your age. Around 45 is generally when they start, but earlier if you have a family history. The mammogram, pelvic exam, colonoscopy starting at 50 or earlier if you have a family history or risk factors. I mean, everything is tailored to that individual's problems, symptoms, family history, and risk factors. So it's really important that it be individualized.
And often you can see by looking at your mother or your grandmother's symptoms in their later ages, you can get an idea of what your body may be inclined to get.
Right. So, for example, if somebody has colon cancer earlier than 50, that would move up your screening date. Same thing with breast cancer. So everything can move forward depending on your mom, your grandmother, your grandparents, your aunts and uncles, things like that.
And some people may say, well, I know what the signs are for certain things, so I don't have them, so I don't have to worry about it. But you said there are some really serious illnesses that pelvic exams may not show unless you get special tests.
Right. For example, the pap smear, it's a cervical screening test. You wouldn't necessarily be able to feel that or know that. So it's the same thing with your colonoscopy or your mammogram. Sometimes things are so small that you can't necessarily feel them on monthly breast checks.
Okay, and let's talk about vaccine boosters. When you think of vaccines, you usually think of getting the kids' vaccine, but moms are not thinking of themselves. Why is it important for moms?
Well, okay, so in influenza every single year, that can prevent a lot of morbidity and mortality. A Tdap, a tetanus shot, stepping on a nail can get you really sick. So you want to update that, especially because the new ones have whooping cough in it, which is making a big comeback now. Also a pneumonia vaccine for those greater than 65. So don't forget that adults also need updated vaccinations. Okay,
you also say glucose and diabetes screening tests. You recommend that as well. You've got skin exams, breast exams we went over. Why is weight check important?
You don't know exactly if you're overweight or not until you get your BMI or body mass index calculated, and that's like a height to weight ratio.
Why should you care about that?
Because it makes you more likely to get heart disease, diabetes. There's a certain weight that medically speaking you should be at to limit your risk factors and prevent you from going on to these chronic conditions.
Osteoporosis, some people may say it's just age, your bones get crickety, that's just age. You're saying no, you can prevent that.
Yes, you can. And depending on your risk factors, of course, we might get it earlier, but 65 is generally the time that you do your DEXA or your bone screen, and then that can prevent falls, fractures, breaking a hip, things like that can be very dangerous to the individual. So it's really important to get that done as well.
Okay, some really good tips this morning for all the women in your life. Thank you so much.
You're welcome.